Schizophrenia. Schizo means split. Phrenia means mind. People with schizophrenia have a fragmented way of thinking. Schizophrenia is a syndrome, so there's not a single diagnosis. There are many different symptoms, and not everyone has the same. There are 3 different kinds of symptoms: positive, negative, and cognitive. Positive symptoms are psychotic symptoms. Negative symptoms are the removal of a normal process, and cognitive symptoms are subtle and difficult to notice. They cycle through 3 phases: prodromal, active, and residual phases. To diagnose schizophrenia, they must have 2 of the following symptoms, and at least one of them have to be delusions, hallucinations, or disorganized speech. These symptoms must be going on for at least 6 months, and they also must be in at least a month of active phase. The cause of schizophrenia is believed to be due to the rise in dopamine levels in the body. They believe this because most antipsychotic medications block the dopamine receptors in the body. There is also other evidence that supports this. People who abuse amphetamines, which increase the dopamine levels in the brain, cause symptoms similar to schizophrenia. Here is the structure of the D4 dopamine receptor in complex nemapride. Dopamine is a molecule that is naturally produced in our body. It is a neurotransmitter in our brain, and it is responsible for setting signals in our central nervous system. An overactive dopamine system within the brain causes schizophrenia. Inside this molecule is an antipsychotic called nemapride. Nemapride is an atypical antipsychotic drug used for the treatment of schizophrenia. It was manufactured by Yamaguchi Pharmaceutical in 1991. It is a benzamide derivative, which makes it a potent and highly selective dopamine D2 antagonist. Although the mechanism for action for nemapride is not confirmed, it is believed its antipsychotic effects occur from its selective binding to the dopamine D2 receptor family. When nemapride binds to the D4 receptor, it suppresses the symptoms of schizophrenia because it decreases the dopamine levels with little to no side effects. Treatment can be very difficult. There are many different kinds of medications. Atypical antipsychotics, like the nemapride, are newer and they have fewer side effects. About 1% of the population will develop schizophrenia, and about 10% of people with schizophrenia will commit suicide.